They promise improved sexual performance and renewed vitality, but across Ghana, unregulated sexual enhancement products are quietly flooding markets and street corners. With little oversight and no clear data on the number of users, health experts warn that these so-called natural remedies may be exposing consumers to serious health risks. In this report, ChannelOneNews' Melody Fafa-Potufe examines Ghana's quiet trade in sexual enhancement products.
Swore, flat tummy, form, hips, pejodio.
It is unlawful to sell those drugs, okay? They normally hawk with it.
From Aroga 300 and AK-47 for men to hip-up syrups, the list seems endless. In recent years, Ghana's markets have seen a rapid rise in unregulated herbal enhancement products, boldly advertised with promises of improved pleasure and vitality. Yet, behind the glossy labels and bold claims lies a growing public health concern. Many of these products, though marketed as natural and harmless, are poorly regulated and inadequately scrutinized. Health authorities warn that cases of adulteration and contamination are increasingly common. With a significant number of users consuming these remedies without any knowledge of their origins or ingredients, the risk of adverse health effects continues to rise. There is no nationally representative official data on the proportion of Ghanaians who patronize herbal sexual enhancement products. This lack of information, coupled with weak enforcement, not only threatens consumer safety, but also undermines the credibility of traditional medicine in Ghana, highlighting the urgent need for stronger regulation and oversight. Interactions with a cross-section of Ghanaians reveal that many users are reluctant to admit to using sexual enhancement products, citing stigma and the discreet manner in which the products are sold.
Never.
Never. Why?
I'm the type I believe in a natural way, okay? Yeah, doing it in a natural way is more exciting than using the artificial way in terms of using chemicals or drugs or something.
At
Circle in Accra, a known hub for the sale of these products, attempts to engage vendors were met with resistance. Some openly hawking the product drove the team away, with one woman warning, "If my suppliers see me speaking to you, they will stop selling to me." After several hours, the team met Francis Abbas, who says he has sold herbal medicines and roots for nearly 18 years.
They started here Juma way no, and then I'm on for Nimio, and then I'm on for Nimi. Juma way, Mr. Here, Minyeska, and a Juma way Ankasano, we are a month for Pewasam. A month for Pewasam, be on my own offer, the sober. Oh, and so or whom or to me, a child wants to say, "Oh, Charlie, would do no say, Matisse, a year Juma." But I am afraid the same area, never until we need to meet a business or.
He insists his products are approved by the Food and Drugs Authority. According to him, the business is lucrative, as most of the products purchased daily are aphrodisiacs.
Depending, 10 people. What I say. You are 8 people, you are 5 people.
He argues that government must empower genuine herbal vendors by clamping down on imposters whose activities tarnish the image of the herbal medicine market.
Abain the yes, or yet why in the only abonning more than 10 beers or better. Or boy, but yeah, nipa bibinino. And sometimes they account. Once I was hanging on, over whom be beer say a dear, any Indiantini, nay, and draw green, name, draw red, name, draw yellow, name, what I say. Aha. But obi dear, over whom be say you, but over some foreign medicine be I see Honomocrana. even Krana and register our Ghana din.
The Traditional Medicine Practice Council, TMPC, the body mandated to regulate, promote, and ensure standards in traditional and alternative medicine, admits that efforts to curb the sale of unregulated products have become a vicious cycle. Head of Compliance, Enforcement and Inspection at TMPC, Michael Lawson, showed the team sacks of confiscated product yet to be sent to the FDA for testing. Many bore no expiry date, dosage instructions or visible FDA approval, just faith.
Confiscated products from the market.
Okay, so can you show us some of the products and what they really do? And if they have expiration dates?
So you see, this one, it says that AK-47 for men. So it's actually medicine that is targeted towards men who want it bigger, longer, thicker, and harder. So that's the inscriptions.
Does it have expiration dates?
See, there's basically no details.
Expiration date. It doesn't have anything about the components.
Not at all. Not at all. The only thing they've written there is just the usage. So it is very difficult, and most of them hide selling the selling of these items. They hide it. So sometimes if you go and you don't do due diligence well, you will not see that they've hidden them because they know that there are a lot of problems with these particular medications.
Acting Registrar of TMPC, Yakubu Tobor Yusuf, explained how consumers can identify fake product on the market and encourage the public to alert the Council's compliance task force.
We are doubling down on a national compliance activity. We started with Accra. We'll be moving to other regions in coming weeks. Now, people who deal in this should understand that this is a criminal activity. According to the laws of the Council, if you are caught and put before court, you could go to jail for more than 2 years. A court could fine you. A court could also fine you and also put you in jail depending on the severity of the crime that you are committing.
But how far can one bottle really go? Medical Herbal Officer at the Lekma Hospital, Dr. Sandra Ashong, warns that organ damage, hormonal imbalance, and long-term health complications are real risks associated with unapproved sexual enhancement products.
Because it works with the heart, it usually raises your heart rate as compared to the normal way that the heart is supposed to function. So when it happens and you have some underlying conditions like hypertension, diabetes, it can also lead to other effects.
She urges the public to seek prescriptions from qualified health practitioners before purchasing any sexual enhancement product. The Food and Drugs Authority, FDA, has identified most of the products cited in this report as fake and unapproved.
In the first picture, I can see some products that are in bottles or containers, if I should say this, but they don't even have labels on it. Obviously, if a product doesn't have label, then that product has not been approved by the FDA to be in the market.
The authority insists that only FDA-approved herbal medicines are safe for consumption and advises consumers to look out for proper labeling and registration numbers. In the pursuit of instant pleasure and desire, the fate of persons who patronize these products are left up to mysterious mixtures. One question remains: can regulatory bodies ensure that these products are regulated and fined or eradicated from the system totally? Time and action will tell. Reporting for Channel One News, Melody Papa, Potiphar.